Hi there, my name is Taylor Peltier and I'm a pharmacist at Vancouver General Hospital. I've created this little web tutorial to help you understand how best to perform a literature search while you're on rotation. The purpose is to help you answer your drug information questions as well as any clinical questions that happen while you're on rotation. Performing an effective search is very important, and if you don't understand the tools that we use to search the medical literature, this can lead to missed articles in your search. Missed articles would decrease the quality of your decision making, and they could impact patient care if you miss a really important article that answers your clinical question. So I'd like you to consider some of the terms that you may have heard thrown around or you may have used yourself. Terms such as Medline, PubMed, Ovid, Embase, and Cochrane. I'm wondering if you can answer or define any of these terms as of right now. It's really important that you understand the difference between these terms because it will help you understand how they work together to help you answer your drug information questions. So Ovid and PubMed are the search engines that search databases such as Medline, Embase, and the Cochrane database. So Ovid is like the Google, the search program, and Medline is the data. So it's like a subset of data on the internet. PubMed is also like Google. It is a search tool used to search a database. So the databases collate and index articles published in medical journals so that you can find the articles that are relevant to the topic you're looking for. So the databases are Medline, Embase, and Cochrane. A little bit about PubMed. This is PubMed screenshot. It is often used because it's free and it's readily available, and some people do find that they can find the answers they need from it. However, the issue with PubMed is that up here in this search bar, anything that you search will pretty much search only as a keyword search. When we get to the databases in a minute that we use with Ovid, we have control over the search terms and the mesh terms and how we put them together with a lot more, we can be more specific in the way that we put together our searches. PubMed, you can use search terms and mesh terms in PubMed, but you really need to know how to use it. And the Ovid search tool is much more intuitive, so that's the tool that this tutorial is going to use. It's important to understand the difference between Medline and Embase. Embase is a separate database from Medline, and as you can see from the quote on the screen, it has a slightly different focus. It tends to have a lot more journals in it from Europe and a lot more sort of pharmacology and pharmacokinetics. It can have a lot of pharmacy-based articles that you would not find in Medline. So I would say that any true drug information search or literature search that does not include both Medline and Embase is incomplete. So let's consider this question. You have a 70-year-old patient admitted for pneumonia. He has a history of ethanol abuse disorder as well as a history of alcohol withdrawal syndrome. The usual treatment of the alcohol withdrawal syndrome at your facility is lorazepam, but the physician has ordered pregabalin instead. What is the evidence for pregabalin compared to lorazepam? So you need to formulate a PICO question in order to answer this. So as you know, a PICO question is the patient, the intervention, the comparator, and the outcome that you're looking for to answer your clinical question. So in terms of the patient, this may be a patient population or a subset of populations that you're looking at. The intervention is what treatment or drug that you want to compare, and against the comparator, which is often the most common therapy or the usual therapy, or sometimes it can be placebo. And the outcome is the outcomes that you're looking for to have an influence, for the intervention to have an influence on, for you to know that it's important and relevant. Sometimes you can know in advance that you have a particular outcome you're looking for. For example, you really want to know only about mortality benefit. However, sometimes there's very little literature on a topic, and so you may end up having to use the outcomes that the studies looked at because you only have one or two or a few trials, And so you'll have to look at whatever outcomes they looked at in order to make your clinical decision. So you may or may not specify the outcome when you're doing your actual literature search. So if we look at our patient history here and try to pick out what we would use for our search terms, we have a 70-year-old patient as our patient population. We have alcohol withdrawal syndrome as our, again, part of our patient population. We have the usual treatment of lorazepam, so that would be our intervention, and pregabalin would be the comparator, or probably the inverse. Pregabalin would be the intervention, and the comparator would be lorazepam because that's the usual treatment. So if we're thinking about what kind of search terms we're going to use in our literature search, for the patient, we would start with alcohol withdrawal syndrome. Now, if we were lucky enough that there was a ton of articles and we wanted to narrow it down to be particularly focused on our patient, we could narrow it and use the term elderly to limit the searches to only cover this topic with elderly patients. That said, without really knowing what the literature shows yet, I would probably start more broad and then add the elderly in if I needed to. So intervention is lorazepam. If the results were too narrow, you could broaden this to benzodiazepine. It may be that there's not that many articles of just straight lorazepam versus pregabalin, and so you would want to use the class of the medication, so benzodiazepine, because you know that diazepam is often used as well for alcohol withdrawal syndrome. So you may need to expand, find about other benzodiazepines, and then apply it to your patient depending what you find. You would compare that with pregabalin, and the outcome I would leave open. Possible outcomes, if you have investigated alcohol withdrawal syndrome, you know the possible negative consequences of such a syndrome. You would postulate what kind of benefits you might see for one drug versus another. In this case, mortality benefit, ICU admissions, length of stay, quality of life, occurrence of seizures, any of those could be something that would be beneficial for one drug versus another. But I will leave it open, and if I do, because I'm actually interested in any of these outcomes, as well as anything else that the literature shows me. So I'm just going to move now to a live environment so we can look at the Medline search in real time. So here I am at the University of British Columbia Library website. You will go to Indexes and Databases and you will type Medline. You can see that it comes up at the top as Medline Ovid, and this is where you will click. Again, Ovid is the search tool and Medline is the database that we're searching. I need to log in. Okay, so here we are in our Medline Ovid search tool. So thinking back to our PICO question, the first thing that we're going to look up is alcohol withdrawal. And I'll hit search. Now the next screen that comes up is very, very important for understanding how Ovid works. Basically, when I searched alcohol withdrawal, the Ovid search tool has linked me to MESH headings within Medline. MESH is a term that stands for medical subject heading, and every article that is published and then indexed into Medline is assigned particular MESH terms to help classify the data so it can be searched. So I see here substance withdrawal syndrome and alcohol withdrawal delirium. Alcohol withdrawal delirium seems a little too specific to me, but what I can do is I can click on the scope note and I can see what is included in alcohol withdrawal syndrome, substance withdrawal syndrome, and I can see these are all the terms that if I had typed them into the search box, Ovid would know to link me back to this specific MESH heading. So if I go back and I click alcohol withdrawal delirium and click on the scope note, I can see that had I put on, for example, delirium tremens, it would have also led back to alcohol withdrawal delirium. So that's really helpful. You want to use this scope note when you're doing a search to know if you need to do a separate search for a separate term or if it would be already included in your mesh heading search. Now, if I were to click on something like the substance withdrawal syndrome, what would come up is the mesh tree for Ovid. So if I scroll down to the highlighted section, I can see that Ovid has, in Medline, has shown me that there is 21,059 articles to do with substance withdrawal syndrome. So you can see that underneath substance withdrawal syndrome, there's alcohol withdrawal delirium that has 1,909 articles, and alcohol withdrawal seizures that has 247 articles. That's important to know because if we go back to this screen, there's this concept of explode. And what explode means is that not only will it include articles within that are matched to this specific mesh term, but it will also link to any articles that are, any mesh terms that are underneath it on the tree. So if I were to explode substance withdrawal syndrome, I would get all these 21,000 articles plus these 1,900 articles plus this 247 articles. In general, it's a good idea to explode almost all your searches. You never want to miss an article because Medline has classified it as a mesh term below it in the tree, and so you didn't explode and you missed that article. Focus is a little bit different. Focus means that when they were indexing the article, whoever was doing the indexing made a determination of what the focus of that article was and designated the focus. So this adds a layer of interpretation to your search that doesn't come from you. For example, a really important side effect could be present in a literature in a clinical trial, but because it wasn't the focus of the trial, it's not deemed the focus. So if you were to click focus, it would be excluded because it wasn't the focus of the trial, and your lit search would be incomplete. So as a rule, I always click explode and I never click focus, and I make sure to click on my scope note and my subject heading to make sure I understand exactly what search terms I'm using. Now for this search, we could click on alcohol withdrawal delirium, but as we saw, it's a subsection of substance withdrawal syndrome, so there wouldn't necessarily be any point of clicking on this. Now if I were to just click continue, you would see all these subheadings of the mesh term. But in general, again, this offers a degree of classification that is maybe prone to some error. And so I would never actually choose any of these subheadings. So I would actually go back and I always click include all subject headings before I hit continue. Now at the bottom here is MP, which means search as keyword. So if I were to click this, it would also search any of the articles for the keyword alcohol withdrawal. Sometimes it's helpful to add this in. In general, I found that it doesn't expand my search very much, except for when you have a drug or a term or a colloquialism that you really need to look for that maybe is new or uncommon, so it doesn't have a mesh term. In that case, keyword search would be your only option. So now that I've done that, I'm going to click continue. Okay, so I can see here I've got my first search is substance withdrawal syndrome, and it's expanded, and my 22,000 articles are there. So the next thing I'm going to search is my lorazepam. And you can see it automatically links to a mesh term. I'm not going to bother with the MP search. I'm going to click include all subject headings and click continue. Oops, pardon me, I should have exploded that. I always like to explode my searches. I don't think in this case it will add much, but let's just see. No, the same number of articles. Okay, so the next search term that we came up with was pregabalin. Again, explode, include all subject headings, and continue. Okay, so now if we want to combine these searches, we want to find any articles that talk about substance withdrawal syndrome, lorazepam, and pregabalin. There's a few things you can do. Down in the search term, you can refer to these numbers here, and you can click 1 and 2 and 4. and that will combine them all. And as you can see, there's only 2 articles. Those articles are down here and would only take a quick second to look at and see if they answer your question. It's not a lot of articles though, and I'd be worried that I'm not capturing everything. So I'm going to expand to see all the different things I've searched here. And I'm going to use the strategy that I created earlier, which was to say that if I did not find enough searches under lorazepam, I was going to expand my search to search for benzodiazepine. So now that I'm searching benzodiazepine, I'm going to explode this, include all subject headings, and hit continue. The other way to combine searches is to use the ticky boxes. So in this case, now if I wanted to include substance withdrawal syndrome, all benzodiazepines, and pregabalin, I could check the 3 and then click End. So now I have 10 articles. So again, I can look down at these 10 articles and see what's happening. See what I've found and how relevant they are. So if I'm curious, if a keyword search would have increased my number, one thing that I could do is put in lorazepam as a keyword. So I can continue with a benzodiazepine search and just do the word search, the keyword search that we were speaking about earlier. And then I can combine my 2 word searches, and I can combine my search number 10 with my mesh term searches for lorazepam, benzodiazepine, and my keyword searches. And then, oh, pardon me, that should be 10 or 2 or 6, because I want to find all the articles that talk about any of them. And you can see there's only a few more articles from expanded benzodiazepines to when I include the keyword searches, I only get a few more articles. So my guess is that if I choose all the benzodiazepine and lorazepam, word search and mesh term, the pregabalin and the substance withdrawal syndrome, and click End to combine those searches, I still get the same 10 articles. So I haven't gained anything by doing a keyword search. Okay, so now I'm going to go down and I want to talk to you a little bit about limits. Limits are a way, if you get more than enough articles, too many articles, you can narrow your search to better answer your question. I would say that about 200 to 300 articles here would be an appropriate amount that you could quickly sift through and decide if anything is really helpful or necessary or answers your question. But above a few hundred, you're starting to spend a lot of time looking at articles that may or may not be pertinent. So it's important to consider limits at this point. Now you could click here at limit and see some of the most common limits, but I like to click additional limits to see the kinds of limits that you can actually use. It's important to know that Medline has more ways to limit than Embase, so that can be helpful, and it can mean that it can be difficult to port searches between the two. So you should start fresh in your searches in Embase, and then if you need to use the limits that Embase has available, I would use those. So sometimes students feel the need to limit to humans, and usually that's okay, although I have had students that needed to search into animal models to find the answers to their questions. Sometimes students limit by full text, but honestly, if an article is very pertinent, the librarians can order it for you from anywhere in Canada or in the world probably, so I wouldn't really limit to full text. And the same with English language. While certainly we would prefer an English language article, if the article is in another language, often the abstract will at least be in English, and sometimes you can even stick it into Google Translate and get a sense of the article. So I try not to use these limits if I can. Some of the more useful limits would be publication types. So one thing that you can do is scroll down, and they have all sorts of things like clinical trials, randomized clinical trials, meta-analyses. So if you know exactly what kind of article you're looking for, you can click on it. Another helpful function is you can use the control button and click multiple of the same things. So for example, if you care about all the different clinical trials, you can use a control function and search all of these publication types. Another helpful limit is the years published. Sometimes your preceptor may ask you to find an article that they know was published in the last couple years, and so it can be helpful to limit your search to those years. Another thing may be that if you're searching for articles published since a guideline. So if you have a guideline that you use and you trust, you may want to find literature that's been published on a topic since the guideline was published. So if a guideline was published in 2012, you would want to search literature published after the guideline. Just remember that guidelines can take, at least a year to put together and publish. So if a guideline was created in 2012, I would probably search literature from at least 2011 forward to look for any updates in the topic. Okay? So if we go back from our limits, let me just say for the limits, after you've decided what you would like to limit, you would click what you want to limit, and then you can see here it would limit number 13. If I wanted to limit a different search, I would change which one I have selected, and then I click limit a search. So in this case, I just limited it to case reports, and now I only have 2. Okay? And then after that, I think you're familiar with how to use this library, how to get the full text, how to find the citation, and the article if it's available. I will say that if you go back to the library, you can search here and search Embase. And again, it's through Ovid. So Ovid is the search tool and Embase is the database. And again, you can do the whole search again. It's structured very, very similar, except the mesh terms in Embase are different than the mesh terms in Medline. So that would be important to know. So you would want to recheck all your scope notes and your mesh term tree to make sure you're getting the most appropriate terms for Embase. Okay? I hope that helps, and I hope that you can see how you would use this information in your clinical practice and on rotation. And if you have any questions, you can send me an email. My name is Tila Pelche at Vancouver Coastal Health, or you can ask your facilitators. Thank you very much. Bye now.